For Koreans, forehead reduction surgery is not a particularly effective method for performing hairline correction. So, are there any alternatives to forehead reduction surgery when it comes to hairline correction? Hello. I am Director Choi Sung-wook of Modumo Clinic's Daegu branch. Today, I'd like to talk a bit about forehead reduction surgery. During hairline consultations, one of the questions I frequently receive is it better to have a forehead reduction surgery or a hair transplant? So first, it's essential to understand exactly what forehead reduction surgery entails. Forehead reduction surgery is, as implied, a procedure to reduce the forehead's area. Forehead reduction surgery was originally developed to smooth out forehead wrinkles. It's a method where the deeply wrinkled forehead skin is pulled upwards, the extra skin is then excised, and finally, it's sutured to the scalp. So, from an unconventional approach here, what if, instead of pulling the forehead skin upwards, we pulled the scalp with the hairline downwards and performed the surgery this way? This surgical method was developed with the idea that it could effectively lower the hairline, making it possible for the hairline to be positioned further down on the forehead. However, this particular surgical approach presents numerous problems. The surgery to smooth out forehead wrinkles by pulling the forehead up and cutting off excess skin is almost never done these days. This is precisely because of the issues it presents. The biggest issue with forehead reduction surgery is the scar. Forehead reduction surgery is, in fact, still quite common. Forehead reduction surgery is primarily performed on Caucasians in Western countries. This surgery is not suitable for Asians and Africans. This is because Caucasians usually do not form scars easily. Even if an incision is made on their forehead skin, it leaves almost no scar, so the surgery isn't very noticeable for them. For Asians and Africans, scars remain distinct, making this surgery particularly unsuitable for Koreans. Even if a scar were to heal very cleanly, it would still appear as a white line. As you can see in the photos, in severe cases, the scar may spread and become red, or even worse, it might become elevated, or in very rare instances, develop into a keloid. People undergo forehead reduction surgery because they want to show their forehead, but due to the resulting scar, they find themselves in a situation where they can never reveal their forehead. The second problem is that the hair density of the scalp decreases. What I mean by that is, when you pull the skin of the forehead scalp downwards, the skin will actually stretch out. As the skin expands, the space between the hairs on the scalp inevitably widens. As the space between the hairs widens, the hair density appears lower. We have a black piece of clothing, and if you stretch it tightly, doesn't the black color seem to fade? It's the exact same principle. Those who've had forehead reduction surgery often show reduced hair density in the frontal scalp. We very commonly see cases where the hair density in the frontal region is low. In reality, this problem is very challenging to resolve. Most individuals are actually unaware of this fact, which leads many to contemplate forehead reduction surgery. The third problem is a critical one. It looks very unnatural. Unlike the crown, the design of the hairline is very important. In the case of forehead reduction surgery, during the incision and suture process, as the skin heals, it undergoes stretching again. As a result, the overall shape is altered. Therefore, the outcome isn't exactly the design you initially envisioned. The design ends up changing, making it extremely challenging to achieve your desired aesthetic. Another problem is that women naturally possess delicate baby hairs along their hairline. If you have these baby hairs and then undergo forehead reduction surgery, all of them will disappear. This results in a very unnatural hairline, almost as if you're wearing a wig. Crucially, the M-shaped hairline area cannot be narrowed. When you pull the middle section, you can observe that the skin of the scalp descends downwards to a certain degree. So you might think the reduction is possible, but if you try pulling the M-shaped area, it barely moves. That's just the nature of the scalp. No matter how much you pull, it's hard to bring it down more than a centimeter. What's even more difficult is that it's nearly impossible to narrow the temple areas. If you undergo forehead reduction surgery and only the central part of the hairline descends, it will make the M-shaped hairline look even deeper. Most people who want a forehead reduction are probably also concerned about their M-shaped hairline. However, with forehead reduction surgery, the M-shaped hairline appears even deeper. As illustrated in the image I'm presenting, this results in an undesirable outcome where the M shape becomes more significantly pronounced. For all these aforementioned reasons, forehead reduction surgery isn't a particularly good method for Koreans when considering hairline correction. Then, when correcting the hairline, are there any alternatives besides forehead reduction surgery? Yes, there is an alternative, and that alternative is hair transplantation. Of course, a hair transplant isn't a perfect method either, but with a hair transplant you don't have to worry about a scar on your hairline. Since you're just implanting hair directly, there's no reason for a scar to form. Because the hair can be implanted exactly to the design desired by both the surgeon and the patient, the result will precisely reflect that design. For women, if we meticulously place the finest hairs at the very front of the hairline, it's possible to achieve a significantly more natural outcome compared to forehead reduction surgery. This holds true even if it doesn't entirely recreate the perfect baby hair effect. The greatest advantage is that it is quite easy to correct situations where the side hairline appears too broad. And naturally, since you're implanting hair at the front, you don't have to worry about losing density in the frontal region at all. Taking all these points into consideration, a hair transplant usually produces significantly better results for hairline correction compared to a forehead reduction surgery. That concludes today's explanation. If you have any questions regarding forehead reduction surgery, or if there's anything in my explanation you didn't quite grasp, or perhaps you'd like to present a counter-argument, please feel free to leave a comment, and I will gladly provide a detailed response. This concludes today's session. I am Director Choi Sung-wook from Modumo Clinic's Daegu branch. Thank you.